For everyone with an interest in MASH or, more broadly, steatotic liver disease, surf's up. Surfing the MASH Tsunami's annual year-end interviews with some of the people who made a difference in the mausald world in 2023. Season 4, episode 50+ starts now.
Today on Surfing the MASH Tsunami.
The aspiration and commitment to win, this is something that has said, this is our goal, is the sovereign and free and democratic Ukraine. I think this is something that has not changed. We have over 20,000 people who are officially registered in need of prosthetics, but what the government can do, it's about 1,000 per year, and there is another private foundation, Superhumans, they could also do 1,000 per year.
What's keeping you up at night? I know you can answer almost anything with regard to the war, but I'm just wondering what for you is the most concerning thing right now?
So what wakes me up is that I would rather not think what can happen if it continues in the same situation. We need a much greater support now. We are very committed for it. We know what we want, what is the end goal of our fight, but we are severely under-resourced now. The world has fought for the values of freedom, of dignity, of centering on persons' well-being and freedom, opportunity to develop. We are fighting in Ukraine, we are fighting ourselves, and we must win this war for our country, but also for the broader international community.
As a momentous year in steatotic liver disease comes to an end, the Surfing the MASH Tsunami team is reviewing the year with some of our favorite guests. Today, Fatty Liver Alliance founder and CEO Mike Betel and pricing and forecasting guru Roger Green interview Tetiana Deshko, Director of Programs for the Alliance for Public Health in Ukraine, on how her work and general conditions in Ukraine have changed in the last 6 months, on the Surfing the MASH Tsunami podcast.
So this is part of our year-end interview series, but a little different than the other interviews we've done. For one thing, we're fortunate to have with us again our friend Tatiana Deshko from Ukraine. Tatiana, good to see you again. How are you doing today?
Yeah, good to see you again. Yes, thank you. And thank you for your attention to Ukraine. It requires it a lot.
It's near and dear to many of our hearts and what we believe in. And then because I have Tatiana with me, instead of having Jorn or Louise, we've also brought back Mike Betel, who was part of the last interview. Mike, was this 2 days in a row?
Hi, Roger. Never enough with you. But I'm really happy about speaking with Tatiana again, because she's awesome. And what she has to say is incredibly important globally.
And we agree. So with that, the only thing for my audience is that Tatiana, her transmission is not quite as good as a lot of what we're getting. So she might come across a little bit faint or fuzzy. She is hardly faint. She is hardly fuzzy. She is profoundly committed and passionately committed. It's just her sound. So with that, let's just dive right in, okay? When last we spoke, it was about 6 months ago, right? Middle, late June. We were all in Vienna, and you educated folks who listen to us significantly about the war and how to provide healthcare for Ukraine in general and for the battlefield as well. How are things there generally as compared to 6 months ago?
I think they became maybe even more difficult in many ways, that now we understand that it will not end fast, that the war is with us and it will last for some time, and it will continue to bring very severe losses to Ukraine. It is not only people on the front line whom we are losing on daily basis. It is not only territories that have been mined and that have been lost and then retaken. It is also people's daily life, which has changed so much. It's almost 2 years that we are in war, and what it means. Everyone is affected. People are working to support the battlefield. They are working to support our country. They are living in daily stress. We have air raid sirens almost every day. And, this is something that may make you jump out of your regular daily routine 4 hours a day, and you don't know how long and where it would end. And I think, we understand that it is a very difficult battle to fight, and that we maybe feel feeling, our resources are getting exhausted, and we understand that we need to work hard to replenish them, and we don't see a quick and easy win. So I think this is the thing that has changed a lot, is that maybe understanding that it is a very difficult and long battle, and we have to work very, very hard to get to our victory. And we are committed to it. But I think now, with being more knowledgeable and being more maybe sober in a sense in terms of what lies ahead of us.
So how does that change the morale of the folks there? I mean, more stress, more strain, longer fight. How does that change the people? How does that change how you and your friends are looking at life these days?
Well, I think more people, of course, are fighting now on the front line. The people with whom I studied or with whom I worked, more of them are now in the front line, and they are fighting, and they are committed to fight. Of course, more people who have been there for a longer time, who have been on the front line for already over a year, well, they're not, you can't say they are tired, but, they are, I think, in a human sense, exhausted in many ways. So you have to continue for long periods and without seeing what this may be leading towards. So I think we are positive and committed, but we understand now much better that it is a long-standing and difficult commitment that will require a lot of our resource, of our life, of our ability to break through a very, very difficult enemy.
That's pretty clear and pretty easy to understand. Are there things that have stayed pretty much the same as compared to where they were 6 months ago, besides the fact that you're still fighting this war?
I think the overall commitment and the aspiration and commitment to win, this is something that has stayed. This is our goal, is a sovereign and free and democratic Ukraine. I think this is something that has not changed, has not iterated. We understand that the goal remains. What we understand is the process, the way will be much maybe harder than we thought. Well, because of the enemy there, but because of also the world is dynamic. We see other conflicts breaking through. We see that there is a lot of attention, obviously, to Israel and to Gaza conflict and to other conflicts. And the longer it takes, maybe the more difficult it would be to mobilize also external support, which we really need so much with war we are at.
Tatiana, Roger and I were briefly chatting before you came on, and one of the things that I heard yesterday was that there was an escalation in the weapons that were being used, that now there's tear gas being used on the southern front. How does that impact patient care and just the people that are there?
For patients, it is a very difficult situation. For people who are in territories that have been occupied, deoccupied, it is all ranges of challenges that they have to go through. I am not aware about major outbreaks related to using kind of tear gas, but on daily healthcare, it's a major challenge. So just for you to give a sense, Ukraine has deoccupied after Russian invasion, as far as it went through, deoccupied 40,000 square kilometers. These are the territories on the east and the south of Ukraine. And just to give a sense, this is 40,000 kilometers of territory which does not have major healthcare, does not have doctors, does not have medication supplies. So you have to arrange something there. And this is about the territory of the Netherlands or the territory of two Israels. So it means that actually we have to arrange something on these territories that are still very close to the front line, where still kind of a lot of people are residing in almost absence of healthcare infrastructure. So we really had to reinvent, what you do there. So what we do, we are working with mobile vans that come to these territories that deliver primary healthcare with doctors, with medication, some of the humanitarian aid. So you actually have to provide some level of care. And a lot of it is also about, support to just mental health support, just people support. People want to talk to someone who would listen to their, health issues. So many things that people have to cope there with. We are trying to arrange medication supply also so that when we come with minivans, we can provide ongoing flow of medications to arrange it with governmental access to medications for these the occupied territories. But it's having to establish a functioning healthcare almost in complete uncertainty. And people who are there, there are still the elderly people, but there are also children in many of the communities that stay there, that did not flee the war. So for children, well, they are kind of arranging some basic flu infection treatment, some other things there.
That sounds tremendously challenging. I know when we talked about this 6 months ago, one of the things you talked about was needing to train medics on how to deal with how much territory was mined. Is that become a bigger challenge, smaller challenge, or kind of stated about the same, and how so?
It is a major challenge, and also how both the military people, the soldiers, as well as the civilians have suffered from violence. This is tremendous. So we are hearing on there are not only legs or hands that have been lost due to people's approaching the mines. Also, people have lost sight. So one of the programs that we are actively fundraising for now is to support a rehabilitation program for war veterans who have lost their sight in the battlefield. And there are hundreds of these people, and you have to be able to, we are seeking to both buy some necessary commodities for them to be able to live without sight, but also to train them new life skills, to train their close ones, how to take care of them, to train them live in new environment. And it's always something new is coming up, so it grows in geometric progression, all the new things that you have to address more and more. Prostheses, it's another major thing. So we have over 20,000 people who are officially registered in need of prosthetics, but what the government can do, it's about 1,000 per year, and there is another private foundation, Superhumans, they could also do 1,000 per year. So it means you actually have times more people who need prostheses, and it's we are not catching up with these levels of need. So there are new things which are emerging, and we have to deal with them very quickly and in very constrained resources.
How do you do that with prosthetics? If you've got 20,000 people in need and 2,000 prostheses available, what can you do for the other 18,000?
Everything. There are some private donors who have funded some major programs, and they continue to run several hubs to do prostheses. Also, some of the existing health facilities, they are trying to establish prosthetics facilities on their existing sites to be able to do more locally. And also there is a lot of fundraising that is taking place between ordinary people, between businesses in Ukraine, outside of Ukraine. People also privately try to find a way to get prostheses available. So all sorts of things. The government is trying to fill up the need as much as possible. But when your national budget it's 60% is a war budget, and we are so stretched, it is critically not enough. So we need to be doing more, both with attracting ready solutions, but also producing more in Ukraine.
So 6 months ago, we didn't talk a lot about prosthesis, a little bit. We talked more, as we were, about mines and about the general problem of having to get people trained to serve as medics. As the war goes on, does that become easier to find people to serve, or harder? And do people stay longer so that your training burden isn't quite as high?
Well, I think we have more and more. We have a larger growing army. More people are being mobilized. More people are getting on the front line. More people are getting wounded. More people require health care. And we are not getting any more resource in Ukraine. We have as many soldiers as we have, and we have as many doctors as we have to cope with a growing health problem. We are becoming more and more stretched in terms of the healthcare proposition, what we can offer to people. More people, men whom we could involve as healthcare professionals in our program, so as social workers, they are becoming mobilized to serve as soldiers also. So we are clearly short of manpower also to do our work. And this is why we are trying to look for solutions to resolve that. So as much as we can to preserve our human capacity. So what we do, we try to rely more and more on telemedicine, for example. So we do more and more work with distant advices by our doctors, and Ukraine is actively seeking to introduce this telemedicine into its regular healthcare provision. We also do more work on with artificial intelligence, for example. So we are working now on a virtual outreach worker who would provide advice on HIV, hepatitis, tuberculosis to people who are at risk of infections. And so it will be like a talking head who would be giving a source by artificial intelligence, would be explaining how you can reduce your risks of infection, or what you can do if you had a risky situation, or where you can approach, or how you can set an appointment. So doing some things that that would just reduce this the cost of healthcare. Very important to do simplified patient pathways, and I think these are some of the important reforms we try to make in Ukraine, so that diagnostic and starting hepatitis C treatment, for example, becomes quick and easy. You do a rapid test, then you do a gene expert, and then you can prescribe treatment right away on the spot and give your patient with a monthly supply, and then support distantly on monitoring it. So really making this, simplified kind of low-cost scaled solutions is a very important task for us now as healthcare providers. In a very stretched resource situation, we have to provide healthcare to a growing number of people with different needs. So we have to be inventive, and we have to be, we have to be smart to be able to deliver this in such a situation.
I think you were that the last time we spoke as well, resourceful and creative and finding unusual solutions. It just sounds like as you've got fewer resources and more need, you have to get better at that. Because I'm always trying to look at the bright side of everything. It strikes me that the one benefit I can see in what you're saying is that when Ukraine comes through this, you will be a much more robust and efficient provider of care to your citizens. This is a terrible way to have to learn those lessons. In
a world of urgency, especially medical urgency, like you've indicated, I wonder when you look at something like MASH that, some would argue it's slow moving, often caused by things, people are eating and lifestyle management, and they all seem so unimportant when you're in a world like where you're at war. So I wonder, during this period of time, do you think that the population's going to be ignored in this case because it's less urgent than, warfare types of things? And when you look back at this, when everything is back to normal, if that can happen, do you think that we're going to look back at this period and go from the perspective only of liver disease? Did things get a lot worse in that time period? I'm just wondering what your thoughts are about that, if you've even thought of that.
I think now is the time when people in Ukraine really deprioritize health very much. I think it's like your daily situation is, you hear air raid siren, you go to shelter. The city may get hit by a rocket, or no, maybe tomorrow you will be conscripted and will actually be fighting on the front lines. People do not think about health at all. Just completely at all. It is really difficult to persuade people to take, any care of their health, and also related to making checkups for their liver too, for hepatitis C testing, because hepatitis C is prevalent in some regions in Ukraine. It's difficult for us having to persuade people to do this test, and it's very often that we have to make a kind of a trade-off. We motivate people with humanitarian aid. We say, well, look, we will also, there is something to support your life, to support your close ones. Let's do the test also. So you really have to motivate people to take care of their health. And I think I think during this latest time, I've seen many older people who have died. It's almost like every month that somebody's parents, all the kind of people are dying because there is lack of care, there is lack of attention, that I think we'll just be seeing more and more people suffering from deprioritizing their health in general.
I think back of the Maslow's hierarchy of needs, right? Food, shelter, clothing. And I think that some of these other things are going to not be a focus point until they can be again.
Yeah.
So, in fact, let me flip to the flip side of that. In a situation like you're talking about, if there's a lot more stress in the society at large, I'm wondering if you're seeing an increase in stress-related disease or morbidities, more heart attacks, for example, things that would be traced to the increased stresses of daily living and less capacity to take care of yourself. I assume you see some of that as well.
Well, absolutely. I will not have the numbers for you, but I would say what I am kind of seeing around me. So indeed, we're seeing actually many more kind of people maybe older or kind of parents of my friends who have died in the last year or so. So indeed many more than before that. We are also seeing regularly hearing about suicides of teenagers, especially suicides in big cities. It is really coming up regularly. So some younger people who have committed suicide. Again, I'm seeing that it is an increase compared to previous periods, but this is something that is happening as well. In terms of kind of mental health, we clearly see that there is an increased need for mental health care support from I think many of Ukrainians who have left Ukraine as migrants. I think most of them have been prescribed some psychiatrist care or some mental health related treatment. So actually there is a lot of mental health need, and some of it is addressed, but most of it is not addressed. People are not actively seeking health care because they're facing other challenges.
Tatiana, you said earlier about telehealth. I wonder, has there been support from around the world? Because that kind of support from the medical community you can get outside of Ukraine, right?
Yes, there have been a number of initiatives to support Ukrainians to provide healthcare advice. I think there's been some led privately, also some try to get channeled through World Health Organization in Ukraine. There are sometimes issues related to language barriers. So many of Ukrainian patients are really like Ukrainian or maybe Russian speakers at most, and they don't speak English or other languages. So you really have to arrange for proper interpretation. And it was both true, also as refugees. I think that's the major problem for healthcare seekers who are outside of Ukraine is to talk to the doctor because they don't speak the same language. That's why it was so critical to keep the contact with Ukrainian doctors who can explain the patient what is needed. So in our case, this telemedicine has often served that the doctors who are wherever they are, patients who are wherever they are, and then with telemedicine, they just get connected and speak on the same language and they understand the prescriptions, because there have been all kinds of situations when like a child living with HIV was prescribed with adult dose of IV medication and no one kind of understood it, and because no one spoke the right language was discovered further on. So there are many barriers to streamlining it, but what is important that we are receiving support to develop these telemedicine platforms. There was also some donors and some companies have supported us to develop this telemedicine solution for Ukraine, so that wherever the patient is and wherever the doctor is, we can provide care whenever needed.
That sounds promising. Different kind of question. Okay. What do you do? What do your friends do to have a moment where the war hanging over your head isn't quite so heavy? Are there things that you are doing right now that allow you to enjoy or escape a little bit or step away even for an hour? Or is it with you every day, every hour?
Each and every Ukrainian is working to bring our victory closer. I think this is like really a daily routine that is with us. And on whatever you do in supporting our army. So we would almost daily donate something to procure a drone or to procure a new vehicle. Also in our work, we know that we will only, me as a health professional, I know that I will only win if we are able to maintain our health care and be able to develop it in whatever challenging the situation is, so that it, in very stretched resources, can respond to the growing needs. So we try to bring in some innovation, some new solution, and we really work daily on it. We try to attract resources to make it possible. And everyone does it. My mother, she's making some weaving some necessary small things for the army, and she says that all her neighbors, also elderly ladies, just do the same, and this is true for everyone. It is a national fight, and it will be a national victory.
I'm going to ask a question that sometimes physicians get asked, so I wanted to know what's keeping you up at night. I know you can answer almost anything with regard to the war, but I'm just wondering what for you is the most concerning thing right now?
We are in a very difficult situation now in terms of the support that we are receiving in Ukraine. Russia is a very difficult enemy, and I think few countries can fight it with its own resource. And definitely we have been receiving international support very generously. But now it's the time when we see we are very short of it, and it has become less. There is the data that we are seeing and what we are hearing for people who are finding is that there are just not enough missiles, not enough shells to respond back. If in summer, there is some data that in summer we could shoot 240,000 larger caliber shells, but now it's only 80,000. So it's really 3 times less than what we could do in summer and what we could do now. We are very short of necessary ammunition. We need international support badly. And I think what wakes me up is that I would rather not think what can happen if it continues in the same situation. We need a much greater support now. We are very committed for it. We know what we want, what is the end goal of our fight, but we are severely under-resourced now.
Obviously, one of the questions I had on my list was what was the impact of the U.S. Congress taking so long to get you the aid that you need, or Orban, what he did with the aid from NATO, and I assume that that's what you're talking about. Without that coming,
exactly,
this is already pretty dire, and without it coming through, that gets a lot worse.
Yes, we are feeling it on the front line very, very strongly. We are feeling it, and you can see both. Well, not only from the data that we are seeing, but also from what we are hearing from people, is that it's just incredible. It's times less than what we had, and we never had enough to respond as much as we wanted. So it is very, very thin now, and we need the resource badly. And also for fighting, but also for the feeling the perspective and feeling the support in future. Next year is the election year for the United States or for Russia too. I mean, these are when it wants to demonstrate some of the even more progress than what it is making. These are very difficult times, very risky times, and it's so important to be prepared, to be well prepared and actually be well resourced when such potential challenges will be coming in.
Well, one of the reasons we're doing this interview is so that we can communicate to people who listen to this podcast. There are more of them than I realized there were, say, a month ago, based on some numbers that we've seen from a couple of our distributors, to motivate them, if they are interested or if they so choose, to hear your story and reach out to their members of Congress and elected officials and whatever else they can do to motivate our Congress to move faster, because clearly it's an important thing to do so. And I think you paint that picture in very, very clear terms.
These are things which are very, I think, clear to a progressive democratic world. We are fighting for human dignity. We are fighting for democracy. We are fighting for the ability to have our freedoms with us. So we are fighting to be able to live and function as a democratic and sovereign state. And I think this is the fight that we have. And I think this is much broader than only Ukrainian battlefield per se. We've seen how much, the situation in one country does have impact on the region more broadly, on how other countries act, on how international community acts. And if such crimes as Russia is committing against us are not punished, it will just bring more and more of the same. And we will be seeing more of these terrible disruptions and crises happening around in the world. And I think the Ukraine, there should be a sufficient response coming on this situation in Ukraine, and it will really stop many of the very dangerous conflicts that can potentially happen with the terrorist state Russia is.
Most Americans still strongly support aid to Ukraine. Unfortunately, one of our political parties is increasingly listening to the guy who they think will be the presidential candidate, and he is the one person who counts Putin as a friend and has never been a friend to Ukraine. So I think that's what we're dealing with here, sadly. I think your last message to the world is a powerful one. If Putin were to succeed there, this will not be the end of it. He will not stop in Ukraine. And that all you're struggling to be are sovereign and free people, which is what we all are happy to be. Is there any other message you would like to share with people who listen to this podcast or people in the West in general?
It's been a very difficult fight for Ukraine and for Ukrainians, but we are fighting for our values, and we are fighting for values. I think the world has fought for the values of freedom, of dignity, of centering on persons' well-being and freedom, opportunity to develop. We are fighting in Ukraine. We are fighting ourselves, and we must win this war for our country, but also for the broader international community. We require the resource desperately now because it has been almost 2 years in fighting. We are constrained in resource, and I think there are many new risks emerging. We need support. We appreciate the global support that we've been receiving, and we ask for more of commitment, more of military support, and more of friendly support. We greatly value when our people could be welcomed in other countries, that they were received. Ukrainian children are studying in other countries, and we get a lot of compassion. 2024 has to be the year when we capitalize on that and when we are able to bring Ukrainian victory close.
That's an excellent note on which to close. Mike, I'm out of question. I don't think there's anything to follow that statement with. You tell, if you have a question, go ahead.
I would just want to thank you and Tatiana for continuing to keep this issue and awareness of the challenges that you're having as a country alive, so the rest of the world knows what's going on from inside the country. And we really appreciate your sharing that today.
And so let's check in again, maybe in another 3 months. Let's not wait 6 months. Let's check in 3 months and talk again and see where everything is.
Be safe.
Wishing you safety and whatever joy you can have in this holiday season, and that all our governments come through and give you the help you need for the amazingly courageous and resourceful fight that you folks are making every day.
Thank you. Yeah, thank you very much for coming back to Ukraine in the time when we need the support most, and when it is when we are very stretched, and when we are under-resourced. It is really valued how you come back in such moment when you need it most. So thank you very much.
Our pleasure. Slava Ukraini.
Героям слава.
And now for the Season 4 End-of-Year Episodes Business Report.
Slava Ukraini, Heroyam Slava, glory to Ukraine, glory to heroes. And also Am Yisrael Chai, the people of Israel live. The last time I recorded a business section for this podcast, the U.S. Congress was delaying getting badly needed aid to Ukraine. The world was decrying the death of Palestinian civilians, while most were forgetting, and even worse, some were celebrating, the horrible rapes, beheadings, and other beastly crimes Hamas committed on innocent Israelis October 7th that precipitated the Israeli military action. I'd love to say that 3 weeks later, things have changed for the better, and there were days of hope in the Middle East during the Israel-Hamas ceasefire. But sadly, little is meaningfully improved. As we come to this holiday season, let's hope the Ukrainian military maintains and perseveres through the coming winter, and that we can find a solution in the Middle East that preserves an Israel that does not have to fear its neighbors and allows a Palestinian people who live next to them to find peace and prosperity and pursue a better quality of life for their families and themselves. Slava Ukraini, Am Yisrael Chai.
Congratulations, Yarn, and welcome back.
Last time we met, it was too soon to announce Professor Schottenberg's promotion to department head at the medical school in Saarland. Well, that's official now. Jorn has assumed his new responsibilities, and he will be with us on a more or less regular basis going forward. We may need to work a bit on how to improve his internet speed and reliability when staying overnight in Hamburg. I'm sure we'll work that out.
Hey, Spotify, thanks for the good news.
Last week, we received from Spotify their wrap-up numbers from 2023. What these numbers told us was that we had more growth this year than we had anticipated. 50% more listeners, 11% more streams, 72% of people listening doing so for the first time. And if we extrapolate up from Spotify's share of our entire listener pool, 3,000 listeners who rate us in their top 10 podcasts, 2,000 rating us in their top 5, and 750 rating us their overall top. Those are bigger numbers than we thought we had, and we're excited to know that so many people are gaining benefit from this podcast.
You will see new graphics and a new email address when we all return in 2024.
In the interest of efficiency and recognition of Eric's increasingly demanding schedule, we decided to execute the entire graphic and website cutover to MASH Tsunami. All will be fixed when we come back in the beginning of the new year.
The vault is closed for 2023.
Historically, we've included neither Vault conversations nor business sections during the year-end interview series. No more Vault this year as well, but there are a few business section comments I want to share. These may change during the interview week or not. If they change, we'll let you know. And that's it for the year. I want to thank our team, Jorn, Louise, Jake, Mike, Eric, Steve, for their work throughout the year, and more important, to thank you, the listeners, who stuck with us throughout. We've got more interviews ahead, and after that, we'll be back early in January with a new year of episodes and perhaps some new features as well. Until then, enjoy the holiday. Happy 2024. And as always, stay safe and surf on. Bye-bye now.
Join us tomorrow when our interview partner will be hepatology researcher and key opinion leader Professor Scott Friedman.